Hi everyone and welcome back. Today we are going to discuss the different types of body system complications that can happen as a result of diabetes. These complications are known as micro and macrovascular disease. Our hopes are that through this online lesson you will not only feel educated regarding the disease process of diabetes, but you will be able to advocate for yourself, ensuring all of the recommended testing is being done to prevent long-term damage or recognize issues early enough that you are able to take charge. Before we begin, if you have any questions from last week's lesson, please feel free to email your provider. You can also share with them any of your successes or struggles. This is a great time to reflect on your personal growth and also recognize areas that you still need to nurture and support through this process of changing your lifestyle. I'm going to briefly review the objectives that will be met as a result of completing today's lesson. At the completion of today's lesson, you will be able to identify the most serious complications associated with type 2 diabetes. You will be able to describe the organ groups affected by diabetes, understand screening tools used to assess for vascular damage, and understand the benefits of improved glycemic control on reducing risk of end organ damage. So let's begin. What is the vascular system? The vascular system, also known as the circulatory system, is made up of vessels. This is veins and arteries that carry blood and lymphatic fluid through the body, delivering oxygen and nutrients to the body tissues and taking away tissue waste matter. Veins. These are any vessel that carry oxygen-depleted blood toward the heart to be resupplied with oxygen. Arteries. These are any of the blood vessels that carry oxygenated blood away from the heart to the body's cells, tissues, and organs to supply them with the oxygen necessary to function. So what's the deal with diabetes in the vascular system? High blood glucose levels damage veins and arteries over time. High blood sugar levels cause the formation of fatty deposits in blood vessel walls. Over time, this restricts blood flow and increases the risks of hardening the blood vessels. This is known as atherosclerosis. Picture a wide open hose. Over time, a deposit of debris begins to collect on the wall of the hose. This will narrow the open area and therefore limit flow. This leads to heart disease, also known as coronary artery disease or a heart attack, peripheral vascular disease, which is a disease of the vessels in the legs, cerebral vascular disease, a stroke, retinopathy, eye disease, nephropathy, kidney disease, and neuropathy, nerve disease. We will review each of the listed complications in length later on during this presentation, but I want you to have a visual of the wide array of body systems that are affected by diabetes. Diabetes is a multi-system disease. Getting control of your diabetes is not just simply about improving your blood sugar numbers. It is about preserving vital organs in your body so you can live a healthy, fulfilled life. As you can see, diabetes affects everything from the top of your head to the tips of your toes, literally. We will now begin reviewing the three main microvascular, micro meaning small, vessel diseases associated with diabetes. Micro, again referring to the small veins and arteries, include damage to the eyes, also known as retinopathy, which is a leading cause of blindness. Damage to the kidneys, known as nephropathy, which is a leading cause of kidney failure. Think dialysis. And damage to the nerves, known as neuropathy, leading to impotence, diabetic foot disorders, amputation, severe infections, and other debilitating effects on your limbs. Diabetic retinopathy, also known as diabetic eye disease. This occurs when the blood vessels in the back of the eye, known as the retina, are damaged by prolonged elevated blood sugars. Think of a sugar crystal. It has sharp edges. When the blood has extra sugar in it, there are extra little sharp crystals that rub on the blood vessels. This damages the vessels in the eye and causes them to bleed. Bleeding from these vessels can cause the appearance of floating spots. Diabetic retinopathy is a leading cause of blindness. Between 40 to 45% of Americans diagnosed with diabetes have some form of diabetic retinopathy, although only about one-half are aware of this. Early recognition of diabetic retinopathy is crucial to improve the health of your eyes and potentially reverse damage that is occurring. So what can you do to protect your eyes? You can control your blood sugars by taking your medications as prescribed, staying physically active, and maintaining a healthy diet. You can prevent or delay vision loss. Get a comprehensive dilated eye exam through your local eye doctor as recommended by your primary care provider. Diabetic retinopathy often goes unnoticed until vision loss occurs. Early detection, timely treatment, and appropriate follow-up of diabetic eye disease can protect you against vision loss. Next, we will review diabetic nephropathy, also known as diabetic kidney disease. Kidneys work by filtering or cleaning the blood and removing toxins. Toxins leave the body in the form of urine. With diabetes, the filters of the kidney, known as the glomeruli, are forced to work harder to get rid of the extra blood sugar, which causes them to become damaged. In other words, the kidney is only happy when the chemicals in the blood are perfectly balanced. Therefore, when there's extra sugar in the blood, the kidney kicks it into overdrive to filter it out. Over time, this wears the kidney out and is not able to function at the expected rate. Refer back to the visual of the sugar crystal. Along with the kidney working in overdrive to filter out the extra sugar, the sugar crystals damage the inside of the vessel of the kidney. Because of this, the kidneys begin to leak abnormal amounts of protein, also known as albumin, from the blood into the urine. This situation leads to kidney disease. A small amount of protein in the urine is called microalbuminuria. A large amount of protein in the urine is called albuminuria. Kidney disease is a progressive disease noted by gradual loss of the filterability of the kidney over time. Let's recap. When the filters start to leak protein, the kidney starts to work harder to clean out the blood. Over time, the kidney begins to wear out and the ability to filter blood becomes less. End-stage renal disease occurs when the kidney is no longer able to safely filter the blood and a machine is needed to clean the blood. This is known as dialysis. So what can you do to protect your kidneys and make sure they aren't leaking proteins or slowing in function? There are a few things you can do. Let's review. Control your blood sugars, staying physically active and maintaining a healthy diet while controlling blood pressure help maintain kidney health. Talk to your provider about a medication in the class of an ACE or an ARB. Medications such as lisinopril or losartan are used to slow kidney disease and lower blood pressure. Complete nephropathy screening annually during a routine office visit. This is a simple urine test. Next, we will move on to the topic of diabetic neuropathy, also known as diabetic nerve disease. High blood sugars can injure nerve fibers through your body, but diabetic neuropathy most often damages nerves in your legs and feet. There are 4 types of diabetic neuropathy, known as peripheral, autonomic, proximal, and focal. Peripheral neuropathy is the most common form. It causes pain and loss of feeling in the hands, arms, feet, and legs. Proximal neuropathy produces pain in the thighs and hips and weakness in the legs. Autonomic neuropathy can cause changes in digestion, bowel and bladder control, and problems with erectile dysfunction. Focal neuropathy can strike any nerve in the body, causing pain or weakness. Why this happens isn't completely clear, but a combination of factors likely plays a role, including the interaction between nerves and the vessels, again, vessels being the veins and the arteries. For the sake of this lesson, we will focus on diabetic peripheral neuropathy, as it is the most common form of neuropathy experienced by patients with diabetes and is usually the first type of neuropathy people will experience. Peripheral neuropathy. Think feet, legs, hands, arms. Nerve damage can become permanent if immediate action is not taken to get blood sugars under better control. Symptoms of peripheral neuropathy include tingling, numbness, burning, especially in the evening, and pain. Numbness of the legs can prevent you from noticing injuries to the feet, even small cuts or blisters, which can lead to infection, ulcer, and tissue death, also known as gangrene. This can lead to amputation. Let's think about this for a second. If your feet are burning, tingling, numb, and painful at times, how hard would it be to make a choice to exercise or to stand on your feet in the kitchen to cook healthy meals? It would be very hard. Controlling blood sugars to preserve your feet is so important to continue your pursuit of a healthy lifestyle. So what can you do to protect your feet? There are several things. Blood sugar control is hallmark. Quit smoking. A daily self-foot exam. It is crucial to become familiar with all angles of your feet. Look at your bare feet for red spots, cuts, swelling, and blisters. If you cannot see the bottom of your feet, use a mirror or ask someone to help. You will see a step-by-step guide to performing good foot care on the above screen. Pause the video if you need to write down these tips. Additionally, it is important to mention that you should be receiving an annual nephropathy screening at your PCP office. It is also known as a monofilament test. It is a simple test where your provider, nurse, or other trained staff member will use a tiny piece of plastic to touch different parts of your foot, as highlighted above. You will have your eyes closed. Therefore, you will be gauging the touch sensation based on whether or not you feel the foot being touched with the plastic. If there is a sensory deficit, they will be monitored closely and further action may be sought, such as a referral for diabetic shoes or diabetic foot care. Now that we have reviewed all the small vessel diseases common with diabetes, we will review the big vessel diseases common with diabetes. This is known as the macrovascular complications. There are 3 main types of big artery disease. Coronary artery disease, CAD, referred to as heart disease, disease of the large arteries surrounding the heart. Peripheral vascular disease, PVD, is disease of the major vessels in the legs. And cerebral vascular disease, CVD, diseases of the vessels in the brain and neck. We will review each of these in more detail on the next few slides. Remember, plaques are buildup of fatty debris in the arteries that limit the blood flow. Having diabetes places you at a greater risk for developing big vessel disease. You are at 2 to 4 times more likely to develop plaques if you have diabetes. Heart disease, also known as coronary artery disease. The main arteries supplying the heart with oxygen get occluded, plugged up. by plaques, those fatty deposits we've talked about, which restricts blood flow to the heart. This leads to chest pain and eventually a heart attack if left untreated. A reminder, diabetes increases the risk of plaque buildup. So what can you do to protect your heart? Control your blood sugars, staying physically active, maintaining a healthy diet, achieving healthy weight, and controlling blood pressure help protect your heart. Talk to your provider about starting a statin. This is a medication that's used to lower cholesterol in the blood and helps reduce the risk of heart disease. Common statins are atorvastatin, simvastatin, pravastatin, just to name a few. It is also important to ensure you are getting your cholesterol checked annually and reviewing this with your primary care provider. Peripheral vascular disease. PVD is when the vessels outside of the heart, known as the peripheral vessels, become plugged up with plaques, those pesky fatty deposits, which limit blood flow. The legs are most commonly affected. When blood flow is slowed by the plaque, people will develop leg pain, back pain, fatigue of the muscles in their legs, especially with activity. This pain typically leaves with rest because the body is no longer demanding oxygen down in those muscles. Reflect quickly on this. If your leg muscles burn with attempts to be physically active and rest is the only thing that helps these pains, and no, I'm not referring to the typical aches and burns you experience during exercise. This too is your muscles needing oxygen, but as you improve your exercise tolerance, this improves as well. The burning from peripheral vascular disease is progressive and does not improve as your exercise tolerance improves. Severe cases of PVD require surgery to open up the vessels, while mild to moderate cases are treated with a regimented exercise program, with hopes of creating new little vessels around the blockages to improve blood flow. This is known as collateral circulation. So what can you do to protect your legs? Controlling blood sugars, staying physically active, maintaining a healthy diet, achieving healthy weight, and controlling blood pressures help protect your legs. Quit smoking if you do so. Are you seeing a theme here? To protect the small and large vessels, the plan is the same. Control blood sugars, stay physically active, maintain a healthy diet, achieve a healthy weight, control blood pressure, and quit smoking if you do so. Also, it is important to note that daily exercise helps keep blood flowing to the legs and can help build blood flow around plaques. You may also want to talk to your doctor about starting a statin to help lower your cholesterol. And lastly, we will move on to cerebral vascular disease, also known as a stroke or CVD. The vessels in the neck and head, known as the cerebral vessels, become plugged up with plaques, those fatty deposits again, which limit blood flow and can lead to a stroke. What can you do to protect your brain? Control blood sugars, stay physically active, maintain a healthy diet, achieve a healthy weight, and control your blood pressure will help protect. All of these together help protect your brain. Quit smoking if you do so. Talk to your provider about starting a statin or an aspirin. So let's summarize what we've reviewed today. Big and small vessels are affected by diabetes. Blood sugar control, weight loss, and a healthy diet are important to protecting the eyes, kidneys, nerves, heart, legs, and brain. Make sure you are receiving the best care. Make sure you are getting an annual dilated eye exam, an annual nephropathy screen. Talk to your provider about starting an ACE or an ARB if they are appropriate for you. Make sure you are getting an annual monofilament foot exam, and make sure you are getting your cholesterol screened. Thank you for tuning in today, and we hope that this was beneficial for your understanding of the micro and macrovascular complications associated with diabetes.